For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Welcome to everyone who is joining us here today. We have our special guest, Dr. Gerardo Solorio Cortes. But before we bring him in, I'm going to give an update as to our recent information here within our county. As you all know, last week, Dr. Sarah Cody came and made an update toward our health order, informing all of us to, especially those of us who work in certain settings, and I'm going to go ahead and read them off to ensure that you have the most accurate information to match the CDC and actually ensure that we in Santa Clara County not necessarily wait until the date that CDC provided, but as of January 24th, so as of this month, the 24th, under this new local health order, workers must be up to date on their vaccination, which means either both fully vaccinated and boosted against COVID-19 if eligible for a booster in these specific high-risk settings, which are skilled nursing facilities, long-term care facilities, adult daycare facilities, and memory care facilities, healthcare delivery facilities such as hospitals, clinics, medical offices, dialysis centers, where patient care is provided, as well as medical first responders, jails, and other correctional facilities and congregate shelters. And please, if you're not sure if you fall within that, make sure that you find out to ensure. But if any of those, if you fall under any of those, then that is you. And if you are wondering if that might be you, then it's probably you. So just make sure that we get boosted up for those of you that are not, and then vaccinated if you're not yet. In regards to our additional information, as of the 4th of this month of this year, we have 81.9% of our residents who have all been vaccinated of all ages. And we have our new 7-day rolling average is 1,316. I'm going to say that again. Our new 7-day rolling average is 1,316. That is a lot of cases. Unfortunately, I know that personally, I know a lot of people who have gotten COVID-19 a lot more than earlier in the pandemic. So make sure that if you're not vaccinated or boosted up, if you're eligible for it, make sure to get your booster. Here are the additional information in regards to the vaccinations amongst our county. The information is available on our website, so feel free to look up that information. As I mentioned, 81.9% of our entire residents are vaccinated at this time. As we know, 2 doses are no longer enough. A booster is necessary for better protection against COVID-19 and really for the severe symptoms of COVID-19. So where can you get your boosters? All county vaccination sites offer booster doses, including the drop-in clinics. But make sure to look up on scfreevax.org as our clinics change on a weekly and sometimes even daily basis. But make sure to look up that information and make your appointment if possible. Just a reminder for those of you who might be feeling sick, if you have any of these symptoms, any one or more of these symptoms, whether it's a fever, chills, cough, shortness of breath, difficulty breathing, headache, loss of taste or smell, nausea, diarrhea or vomiting, sore throat, fatigue, muscle or body ache, make sure to get tested. If you are unable to get a test, make sure to stay home until you are able to. You can go to scfreetest.org to find out where there might be a place nearby to get tested. If you're able to get a test, many of these places, schools I know are also sending testing kits to the homes. So if you feel any of these symptoms, please make sure to get tested to prevent the spread. And as we know, just a reminder, Masks are a great defense against COVID-19, and in Santa Clara County, everyone is currently required to wear a mask indoors, regardless of vaccination status. As we remember this model, the more layers that we have, the better for protection from the virus. So getting tested, wearing a well-fitted mask, ventilation, vaccinations. The more layers we have, the more protected we will be against the severe symptoms of COVID-19. And just a reminder in regards to resources, we never know when we need them, but make sure that you take them down if you don't have them yet. Some of the ones that are highlight today are rights in the workplace, the 1-866-870-7725. Mental health services within our county, the 1-800-704-0900. Our crisis hotline, 24 hours, 7 days a week, 1-855-278-4204. Or you can text RENEW to 741-741. It is definitely hard times still for all of us, and we never know how some of this stress and information that gets put out can affect us. So make sure to take down these numbers. If you don't need them now, you might know somebody in the future that might need them. And then the call center, 211. Also, you can text COVID-19 to 211-211, and somebody will respond to you. Just the different ways of being able to get information. Tomorrow we will be having a phone bank available through NBC and Telemundo from 5 to 7. We will have different staff available to respond to questions from 5 to 7 through NBC and Telemundo. You can look out for that as well. Great, thank you. And now we're going to bring in our special guest, Dr. Gerardo Solorio Cortes. Welcome, Doctor.
Hi, good afternoon, everyone.
Good afternoon.
Thank you.
Yeah, happy 2022.
Yes, and as earlier before we went on air, we were hoping for a better, future, and unfortunately, we are in the current situation of the surge, our fourth, fifth surge that we're in, and due to the Omicron variant. You've given the data and the amount of cases that we've had every day, and it's just skyrocketed here in Santa Clara and across the United States. And as you mentioned, this should compel us even more to continue doing what we've been doing since the beginning of the pandemic, which is wearing our mask, the physical distancing, avoiding large crowds, getting tested if you have symptoms or exposed. And more importantly, though, as the data has said, and the hospitalizations have said recently, the vaccines do help, and most importantly, they help on in the prevention of severe disease, ending up in the hospital or even death. So although we're in the predicament or the situation we're in now, I think as we've shown all along, that we're going to come out of this surge together. But very important that whoever hasn't gotten vaccinated, to get vaccinated as soon as possible. And furthermore, if you're not boosted, please get your booster vaccine as soon as possible. The latest news in terms of just the when you could get your booster vaccine for the Pfizer, actually, the CDC, FDA's okaying that 5 months after your second dose, for anyone above age 16 and above, you qualify for your booster vaccine for the Pfizer. For the other ones, J&J and Moderna, the same months stay the same. But again, it goes to show you that we want to vaccinate and boost as many people as possible. And I'm here. Any questions that people may have, please send them to us, and I'll be do my best to answer them. Thank you.
Great, thank you so much. And before we go to some of the questions that we have, please remember the doctor's here to answer any questions of some of the updates that we've given today. And I know we're getting many questions, so I know we have you till 3:30, doctor. So I'm going to do my best to go through the questions and make sure that we do our best to get through all of them.
Yes, thank you.
But before that, I wanted to mention, doctor. I know I mentioned it a little bit. What are you seeing? Of folks coming in. In addition to boosters and vaccines. I know that you are a very trusted and respected doctor. So I know that, when there's people like that in my life, I tend to go to them for other things, right? Are you seeing any other needs other than, obviously this talk and the guidance that you're giving?
No, and thank you again, Karina. That's a good segue. And we discussed it before going on air. The mental health, I think it's been a important issue going along since the beginning with the quarantine, the isolation, the shutdowns, the working from home, the not being around your loved ones, not being around at work. That's just one facet of behavioral health and mental health. And now with this Omicron variant, and then also people becoming infected even though they've been they've completed the series, and in some individuals as well boosted. And there's the thought of, or just the behavioral beliefs, or just the feelings of defeat. So I empathize with my patients, community members, colleagues, that it's a tough situation that we're going through at this moment. And I'm so happy that you mentioned in your last slide the behavioral health numbers. I think if anybody, of course, these forums are focused more on COVID-19 and also specifically the vaccines. But also, I think Karina put in the limelight on the other parts. And there's actually a term that people have been using, the scientists, it's called actually syndemic. When you have other issues, health issues that become worse during this COVID-19 pandemic, and meaning behavioral health, maybe the other conditions that people have in taking care of themselves, for example, or their diabetes or hypertension, things get uncontrolled. So mental health is also another big issue, and I think I've seen it in my practice. So we just have to, again, be kind to each other. If you need any help with, again, COVID or non-COVID issues, please seek out help from your healthcare clinician, or the 211 number. These forums, these websites. I think the county has done a beautiful job of giving a multilingual information on COVID and non-COVID related things that we've been going through with the pandemic. So that's my take, and thank you for putting the limelight, Karina. Thank you.
Thank you. I see in some of the comments some people asking to please schedule appointments and things like that. We cannot do that here, so please continue to make phone calls or get on the SEC freevax.org to schedule your appointments and or your service provider, because we're unable to do that right now. I'm trying to get through the questions here, so let's see. Okay, so I'm getting a question regarding how many are hospitalized, and how many out of the 1,316 numbers were unvaccinated. So I don't know, doctor, if you have any numbers of the current hospitalizations, and then around the current numbers of those that are unvaccinated versus vaccinated.
Unfortunately, I do not have the actual data for the county or our enterprise. What I am gonna say though is that when you compare this surge to the one in January of 2021, we're like 50% less, or maybe percentage wise a little bit more. So what I'm saying is that the the Omicron it's infecting more people. At this point, the hospitalizations is not as huge or percentage wise as it was back in January of 2021. For example, I was looking at the Los Angeles County data last night, and their data was looking at comparing the actual hospitalizations at this moment. There were like around maybe 1,500 at the whole county wide hospitals. That's in comparison to like about 8,000 back in January of 2021. So that goes to show you the 1,000 versus 8,000 hospitalizations. So it's true that at this moment there's less hospitalizations, but in no way does this give us the you know the the motivation to ease off our what we're doing in terms of recommending the vaccines and getting tested, because again, as we mentioned before, the unpredictability of COVID-19 and what the future will tell or what happen. We're very happy that the numbers are not as high when it was in January of 2021, but we need to still do the things that we mentioned earlier today.
Thank you, doctor. And Heather is wondering, how long does it take for the booster to kick in?
Excellent question, Heather. It's very similar to the actual series. 14 days after the booster, that's when officially you would say the booster kicks in. 14 days after the administration of the booster.
Thank you, doctor. Um, we have Amrit, who's wondering, why is it safe for our kids to go to school while you sit at home doing this conference call? It's safe because we are doing everything that we need in order for kids to be in school. Um, as you all know, sometimes I do it from home and sometimes I do it from our office. But I do want to assure you that our schools are doing everything possible. I know my daughter had a testing kit at home. We weren't able to test. We weren't able to send our kids back home unless they had a negative test. And I know that other districts had similar. And we're continuing to ensure, as parents, as community providers, as a health department, to ensure that they have what they need in order to be safe, whether it's face masks, directions. So, for example, their quarantine days are different than those out of school. So, yes, thank you for your question.
And if you don't mind, Karina, just chime in a little bit. Just and we mentioned the mental health and behavioral health, cognition. It's children. It's 2 years into the pandemic, and yes, we health and preventing infection is prime goal. But as Dr. Fauci and other healthcare professionals in our state, county, um, we're doing things safe at school as well, because the development of children is so important too. And school it's an integral and important facet in their upbringing, that it's and so again, there's going to be debate, but that's one of and then again mentioning the school systems put systems in place to make it as safe as possible to allow this teaching to happen.
Thank you. And then David is joining us. What are the available ICU beds as those posted to? This was the metric used in the past. Please talk therapeutics too, because the vaccine boosters should not be the only things to push. Yes, agreed, David. Which is why we've mentioned a couple of the other things. In regards to the beds, I think that similar question was asked in the past. Doctor, I don't know if you have anything to add to this question.
No, but I think that's a good point. Maybe in the future forums that we do, if we're able to post the hospital beds in ICU, that's a good data point. And I will mention, and I think it's excellent point. Thank you, David. Um, when it comes to the therapeutics and the FDA has recently emergency authorized two oral medications. One's, and pardon me if pronunciation's a little bit off. One of them's Paxlovid, and that's coming from Pfizer. The second one's Molnupiravir, and that one's coming from Merck. Um, the Paxlovid oral medications is given for 5 days, and it's approved for anyone above the age of 12 years old, and their pounds is greater than 88 pounds. Studies have shown that there's an 88% reduction in hospitalizations um, and deaths. So it's an excellent medication. Like I said, like I mentioned, it's given for 5 days, and the caveat, of course, that there has to be a positive PCR test. Um, I am mentioning it because there are systems and clinics in the county that have this medication available now. So very important that I would if you're positive, to seek medical attention with your healthcare clinician, and then ask about if and let me go back. Of course, it's for people with high risk conditions, for example, undergoing chemotherapy, diabetes, hypertension, age greater than 65. So if you're at high risk of severe COVID infection, then you would meet criteria for Paxlovid. I do not have all I know about Merck currently is that all I know about Molnupiravir. It's from Merck, but in terms of dosage and days, unfortunately, I don't have that information. I apologize for that. And then lastly, the monoclonal antibody treatments. Regeneron is the one we're using up until Omicron, because studies have shown that it wasn't as effective. There is another monoclonal antibody, and I unfortunately didn't write down the name. Stanford University Hospital, I believe, does have it. So you would have to go to their website, and they have a information on how to register and how to come in to the clinic and get that IV treatment. So excellent questions. I think when COVID pandemic started, it was always the behavioral things that we do. Number one, number two, coming up with the vaccines. Number three, the therapeutics, the medications. As you know, when hospitalizations, there's remdesivir and others that have come out as well while you're in the hospital. And then luckily the monoclonal antibodies for the pre-hospitalizations. And now very excited to have the oral medications. Thank you.
Thank you so much for such detailed response. And we have Andrew Borkowski, I think. And he has several questions around the mask mandates. And I think, really, Doctor, I think they're around kind of why are we still using them? What justifies the mask use? So maybe we can let us know around the mask use. Why are we still using the masks, indoors and with others?
I mean, it's the basic thing that we've used since this pandemic started because studies were done, and you can look at studies of having an individual coughing with no mask, the individual on about with no mask, um, the saliva, fomites, infection happens. That's number one. Number two, you have an individual with COVID, mask, and another individual who's healthy and no mask, and there's a less chance of you know acquiring COVID. Now you have two individuals with mask and mask, the the rate is even lower of infection. So it's the basic science that why these mandates, why this masking, why this limiting of people in certain places, why do we recommend ventilation, being outside and such, is because there's actually been science and looking at where the outbreaks have happened, and it's been in spots where there has been no masks, or there's been no ventilation, or there's been close contact. So that's it's a excellent question, but it boils down again to the science we've done throughout this pandemic.
Thank you. We have our next guest here, Angelina Morales. She says, both of my children tested positive. I work in the health. My employer says I should go to work as long as I don't have symptoms and I'm fully vaccinated. Is this correct? I feel like I'd be putting my coworkers at risk and leaving my teen at home by herself while she's infected.
This is a very excellent question, Angelina. It's actually one that even within our system, our administrations is coming out with policies. So I would probably go back and just get clarification and ensure that you're getting the information from the right administrator, because it does depend if the infection or exposure, for me, for example, me being a doctor, if the exposure happens um, at home versus if the exposure happens at work, in terms of being out 5 days, staying at home, getting tested, or being out 10 days. That's still a work in process within our county system. So I would encourage you to go back and talk to the supervisor in terms of what's. And I gotta tell you too that things changed with the CDC coming out last week, saying okay to go out of quarantine 5 days after in a negative antigen test. It was sad, but at the same time, your system, the county, your employer has to be ready. So I would encourage you to go back to them and see what the process is in place right now, and you're right, to be safe, to ensure that you don't infect your colleagues.
Thank you. And we have Tina Morrill, who's wondering, my question is about people with type 2 diabetes. For someone who is vaccinated and boosted with a controlled diabetes type 2, how has COVID-19 and more specifically the Omicron variant impacted them? I have found very little reading material on this issue, and there is so many people with known or undiagnosed type 2 diabetes.
Excellent question, Tina, and thank you so much. The data, if you look at it in terms of what were the medical conditions that were more common in individuals that were positive for COVID, and furthermore that were in the hospital or in the ICU, or unfortunately passed, a lot of those conditions were diabetes, hypertension, obesity, high cholesterol, and then, for example, like other immunosuppressive conditions like renal kidney disease, dialysis, and heart failure. Now, for the question about controlled diabetes or not, and if there was a difference between outcomes with, or was there a difference of of severity of COVID with controlled diabetes versus uncontrolled diabetes. I do not know the data. I don't know if there was a study that looked specifically at that marker, um, or if that data was just taken on all comers, meaning all people with diabetes. So unfortunately, I don't have that information. What I do is that, just looking at, if I was to um, make comparisons with other conditions, for example, like a pneumonia. If I had a patient with a pneumonia who had diabetes, one's controlled and the other one's uncontrolled, a pneumonia, a bacterial pneumonia on someone with a uncontrolled diabetes would have more, would have worse, outcomes.
Thank you. And we have Angelina Morales, who's wondering if the COVID hours will be coming back for workers. That's a very good question. I don't think, Doctor, you have an answer for that. I know that's something I was wondering when my husband tested positive and he was quarantining in the room, by himself. So it's like, food and making sure the groceries and any needs were met. I know I have to use my personal sick hours, but I don't think, Angelina, that we know at this time. I think that's something that comes down from federal, state,
Right.
and county. So I'm hoping, Angelina, I'm with you. Um, hopefully those COVID hours come back. Doctor, I don't know if you have anything additional.
No, I don't have any more information.
All right, and we have Joyce Landes who's wondering how long does a Pfizer booster effective?
Joyce, it's I'm taking my time because I don't have an answer. We don't know. We're hoping for the best, preparing for the worst. Meaning, will there be a booster in 6 months, 12 months? Is this going to be a vaccine similar to the flu shot that we recommend yearly? Um, it's pretty much we're waiting and seeing what this surge is gonna do, and then the months to come, is it gonna be a seasonal thing, kind of like the flu? We don't know yet, but at this moment, being boosted um, protects you from our current, or you're better off in this surge being boosted than not being boosted. Not being boosted.
And we have Beverly Bassett who's wondering, is it possible to get a second booster 6 months after the first one? And I don't think we're there yet as a county, right, Doctor? I don't know if you have any information on that.
So Beverly, the question is it possible to get a second booster?
So I know
Yeah,
we're asking folks.
I got you. Yeah, no, yeah. I was getting confused over the series.
Mhm.
So someone missed their 28 day second shot. So I was like, but we're not there. Kind of like I was answering the previous question. Um, this variant, this Omicron, has come about, and this 5 months, I'll just give an example. Like the information changes, or we update our science. Pfizer was recommended at 6 months. I mean, yeah, at 6 months, and now it's 5 months. So that's what we're getting to, the fact that we don't know if the next booster is going to be at 3 months, 5 months, 12 months. Yes, people might see what's happening in, for example, Israel, because I've actually kept up with the data across what's been happening across the world, and I do know that looking at the literature or the updates from Israel, they're getting I believe a, a fourth booster 3 months after their booster.
Mhm. Thank you.
For certain individuals, for example, healthcare providers and people with high risk conditions. So,
Mhm.
like I said, only time will tell when our booster if a fourth booster is going to be needed.
And stay tuned, because I know as a county, if that is, we're going to make sure to let folks know. I know right now since the first time the vaccine came out, we're doing all the 6 months, 2 months, depending on. And so I'm sure that time will come around for those of us that got vaccinated early on. Okay, and we have Amy Becker, who's wondering, what is an employee's recourse when an employer will not allow them to call in sick without a negative test, even with COVID symptoms? Additionally, what is an employee's recourse when a coworker tests positive and does not quarantine for a proper amount of days and comes back to work with symptoms? And what I'm going to do is I'm going to provide the phone number to the Santa Clara County Office of Labor Standards Enforcement for legal advice line for free legal advice and any advice around labor standards. So please take down that number, 866-870-7725, and somebody will be able to provide you with that information in regards to your specific situation. I don't know, Doctor, do you want to add anything else to that?
No, I think if I had a patient who came with that question, I would direct them to that phone number. Thank you.
Perfect. Thank you. We have T. Villarreal Alarcón, the new virus. How is that effective? Kids with asthma compared to other ones? Do you know, Doctor?
So the actual, like I mentioned a few. Thank you again for the good question, T. Villarreal Alarcón. A few minutes ago, I mentioned the hospitalizations they're not as bad as back in January of 2021. It's specific for the kids, and I think the numbers are the same in terms of just the with asthma. I haven't come across data that says that this Omicron variant is affecting people, children with asthma worse compared to others. So I'm not aware. So I'll just point blank say that I'm not aware that there's a condition, be it diabetes, hypertension, or asthma, that are making people more susceptible to a worse outcome than compared to the other variants.
Thank you, Doctor. And we have a next question from AJ April, who's wondering, I think the same thing we just covered in regards to a second booster needed against Omicron for people who got their booster in September. So I know we responded to that. Thank you, AJ, for coming and participating. We have Tara Narmita Williamson. What if a 12 to 15-year-old who is more than 6 months from a second vax is exposed before they can get a booster? Do they need to quarantine for 5 days, or can they follow procedure as if they are vaccinated?
And that's Tara, excellent question. And I agree with the quarantine for 5 days, because that's pretty much that quarantine for 5 days is those not vaccinated and not boosted, or kind of like the situation where they're 6 months away from they're not allowed to be boosted now.
I think, Doctor, I know the exposed piece versus they actually have it. I'm obviously not a 12 to 15-year-old. I'm a mature adult, but I know that when my husband had COVID-19, I was obviously exposed as a wife, and so I didn't. They had me. I guess for me, it's important to, because in my mind, I thought I had a quarantine for sure, because I was a for sure exposure and all of those things. But I think the most important piece for me at that time was to get tested as soon as possible to then confirm. So, and I don't know, Doctor, correct me if I'm wrong, if that would be the best thing, for this teenager to get tested as soon as possible.
Definitely, exactly. It's a 5 day. Usually, recommend 5 days after known exposure to get tested, but definitely quarantining for 5 days is what I would recommend as well.
And another thing they asked were the symptoms, if I had symptoms or if I had zero symptoms.
True.
So I had zero symptoms. So that was another factor. So I think I'm saying all this to ensure that you call your service
Yes.
provider as well, so that they have the specific time to ask you all the additional questions that we might not see in here. Um,
Thank you so much.
and I'm so glad that we have, our Dr. Gerardo Solorio Cortes
And
available.
I bring it up too because someone says, well, yeah, I got the vaccine. I'm okay. Did you get the booster? No. So if you're gonna get the booster, you're kind of back in square one. Yeah, we're glad you got it, but as it relates to this, very good points. Very good points.
Yeah, no, these conversations, right? All these details. Thank you, Doctor, for being here to answer these questions. Okay. Next question we have here is 6 months after your second shot, I will. Oh, whoops, they're answering. Thank you, Barbara, for participating. Let's see. Next question. Um, I think we have Andrew again regarding the masks. What's the criteria to remove the masks mandates? I know, Dr. Well, I know myself, I don't have the specific criteria. I don't know if Dr. Solorio has that, but we can find that out hopefully for the next community forum. Do you have the specific criteria for that, Doctor?
I don't have, no, not specifically for the mask mandate.
Yeah, thank you.
I mean, what we've always done is looked at the positivity rate, um, hospitalizations, all that data is gathered. And I think I'll bring up the point too is some individuals, although being vaccinated and boosted, because of their immunosuppressive condition, are not going to have a good defense from a vaccine standpoint. So if we're seeing that there's a skyrocketing infectivity going on with Omicron, and you know masks could help out, is specifically the most vulnerable. I think that's the science that's behind it as well. The sheer number of infected.
Yeah. And I think this next question kind of also guide is one of the county's top priorities to keep schools fully open. Please keep them open. And I think in relation to what you were mentioning, is we want to keep them open, but obviously one of the priorities is ensuring that we're all safe and healthy. So the way we're going to do all that, and because it's you, me, doctor, and the rest of the community that's listening in, and all of us, right, that live here, that we are able to ensure that we are doing our part to make sure that we keep schools open or things like that. It's funny because my husband had a project to be completed and he had to get it, printed at a FedEx. And he went to 5 different ones and they were closed. And they were closed due to staff, having COVID. And so are we in a shutdown? No, right? But if we don't follow these things, if we don't wear these different layers, such as masking, distancing, boosting, vaccinating, then there's going to be an effect. It's a cause and effect, as we know. So yes, Cam, I'm with you. She also says our families has suffered enough due to schools being closed. I agree. I have a 13-year-old who, flourishes in person and, in school. So yes, I agree. Our schools need to stay open. Our, different stores and things that, hospitals. But if we have people that cannot go to work, then that's where the issue comes in. So we all need to do our part in order to continue. As we know, the purpose of vaccines and boosters is to avoid severe illnesses, right? It won't prevent you from getting COVID. My husband was a good example of that. He got COVID and he was fully boosted and all of the above, but he still got it. But it definitely prevented severe illness and or hospitalization, and that's what we're trying to prevent. Okay, let's see. David. I'm looking through the questions or 4 questions through the comments. Let's see. Thank you for your patience. Just want to make sure I get to all the questions. Um, Yay, we have Ruth Daniel here. What about healthy eating and exercise? Nothing on that. Absolutely, Ruth Daniel. I think you missed one of our guests that we had a couple of weeks ago, where we just focused on that. Today was a different focus, but absolutely, I'll let the doctor take it on from here.
No, Ruth, thank you so much. I mean, I think, I mentioned a few minutes ago the issue of like a syndemic, of having multiple things at once. I think that this forum is only an hour, but easy, we could go 24 hours just talking about the different facets of COVID and how everything's affects COVID and everything around COVID, the disease and such. But definitely, not to sugarcoat, one of the tenets of healthcare is uh, a healthy diet, exercise for everything in terms of um, uh, uh, your whole systems, uh, cardiovascular system, pulmonary system, and including your mental health. So yes.
Hmm. And then I would, I would add, in addition to that physical piece, right? As we talked about, like the mental, emotional, the
Yeah.
energy, like we keep consuming and reading about, Omicron and what's next, and you listen to, and that's all you hear about and talk about, then that's going to affect you as well. So sometimes it's good to shut off, computers and the TVs, and maybe take some time to read or go to the sun when it comes out, and shines a little bit. Um, Take time to, drink a nice hot tea, with strong herbs, and maybe go and touch Mother Earth, the soil, and plant some
Yes.
seeds that will eventually grow. Where it's
Yeah.
squash or anything, right, that will keep us healthy. So all those things are interconnected. So thank you so much, Ruth, for joining us and bringing those points up. Okay, let's see. Going to the questions. You're doing a great job, Doctor. um, and as I'm looking through, Doctor, can you remind us where you're stationed?
Oh yeah, but I got so when you introduced me, but yeah, I'm a primary care doctor at Valley Health Center, Gilroy, and I've worked through the Valley Medical system. So very proud to be part of this county system and hospital system.
Thank you. We have another question about ICU numbers. So I did jot that down for our next community forum. Hopefully, I can bring specific information on that. Let's see. So glad that you're all joining us. Um, mhm. Oh, we had a question. I think as you were talking about it, I was going to hit it next, and I didn't. But somebody asked about if somebody tests positive at home, in their home, if you can kind of guide them through that.
In terms of the
Sure.
isolation,
Yeah. So could you share best practices for the rest of us if someone else in our house tests positive?
that's an excellent question, Sheila. Thank you so much. Um, yes, so I'm taking my time because that was one of the biggest issues at the beginning, especially in my community patient population here in Gilroy, where you had multi-generational um, families living together. Because the number one answer is going to be, if you have a room, or yeah, and there'll be a room because you need quarters that are closed. Um, to be isolated, kind of what you just mentioned, Karina, with your husband, and pretty much that individual should have their own room, their own bathroom. Um, if for some reason there's a shared um, commonplace walk area. That person that leaves that room who's infected should be wearing mask all the time. Um, Obviously, showering, try to keep it in a separate, bathroom if possible. Again, I think I'm mentioning what happened more in March, and with my patient population in terms of not having the luxury of having an extra room and such. So that's why the county and other states have these um, hotels where people could quarantine. I don't think we have it now, but we had it back in March. But yeah, in your own living place, if you're able to keep that patient, that family member who's infected, as isolated as possible, and of course you'll be the one doing the cooking and such if possible, so that person doesn't leave that room to the shared common place. And of course, washing and utensils and such would again, the person who's not infected wearing a mask as well, wearing gloves, washing hands, and keeping yourself as much as isolated as possible and clean in terms of using the your PPE, gloves, masks. But excellent question. Thank you, Sheila.
Thank you. So I think I've gone through them, and I think I have all the questions so far answered in regards to this specific community forum. I did write some notes for our next one in regards to hospital, ICU beds, and detailed data around that. So hopefully we can come back and you all can tune in again in 2 weeks. We do have several who mentioned thank you, Dr. Solorio Cortes, thank you, Dr. Solorio, and who are very grateful for what the county is doing. It is, a lot. We're moving with the times, ensuring that we bring information as we have it to you all. And not just, in this way. This is one of the many ways you've seen us on TV. You've seen us, on different social media places. You've seen us on billboards, doing our best to ensure that our county and those in our county are safe and healthy. If you have any questions, you have several numbers. If you remember any of them, maybe that 211, will be easy to jot down and ask us for any additional questions that maybe weren't answered today. Thank you again, Dr. Solorio Cortes. Any last comments you want to close our segment here today with?
No, again, thank you again for the opportunity. We get it. Healthcare clinicians, we're doing our best, and you're all doing your best too. So keep on, wearing your mask, getting tested if you have any symptoms, isolating, quarantining. Also, getting vaccinated if you haven't been boosted or started your series kit, get vaccinated as soon as possible. But yeah, we'll see you until next time, and thank you for the opportunity.
Thank you so much, Doctor. Take care, and we'll see you at the next community forum.
Take care.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.